Okay, now let's see. I love being outdoors. Really enjoy gardening. I love swimming. But most of all, I love cooking for my husband.
She's just been great. We've had a wonderful time. We work together as well as have been together. So we basically have been together 24 hours a day, and we just have a great time. In our roofing business, Luann was extremely vital to our success. We did all the sales together, and she was really, really good with the customers and finding out information and making things work. Well, we had a lot of ups and downs with our business through the years. The economy would get bad and we'd get slow and we'd struggle just to keep going. After she had back surgery 9 years ago, everything changed. There's been several times when all of a sudden she just couldn't breathe. And I would have to call the medics and just hold my breath until they would get here.
So the people that we tend to reach out to at Highline Health Connections are that vulnerable population of people that tend to come to the emergency department at Highline as their primary resource of care. They're typically under-resourced, both financially and socially. Many of the significant health conditions that we do see include COPD, which is a significant lung disease, congestive heart failure, diabetes, and sometimes a combination of all three.
An urgent issue for Luann and Pete was their financial stressors. In addition to that, having a home, one that they could afford, but also one that was accessible for Luann to be able to leave the home, to get to her doctor's appointments, and also just have a good quality of life.
We have a lot of folks, and even more now with what the economy's done, where they're homeless or they're living barely making ends meet, and they can't get the treatment they need, specifically medication, sometimes surgery. So it's a tough problem, and if we can't treat them properly, they do poorly and they come back to the emergency room or to the office because they're not getting the care they need. It's a combination of being a provider, a medical provider, so you see it firsthand every day. But also when I drive around Burien and White Center and even Normandy Park, you see people that are living in tents or living in their car, and you know they need care on a regular basis and they're just not getting it.
Well, Luann was in the hospital at Highline Medical Center, and we were visited by some people from Highline Connections and explained their program and what it might be able to help us with, and it sounded great.
At Health Connections, we empower our participants to be their own health advocates. First of all, by taking control over their own doctor's appointments, understanding their disease processes, and knowing who and when to call in case of a question or concern.
Once people are identified as good candidates for the program, we meet with them in the hospital prior to discharge so that we can discuss the program and then schedule to start working with them within days of their return home.
One of the beauties of our community is that we have people of means, we have people that really care, yet there are people in need. And so the goal is to get them together, the people that want to help, show them how to do it, and not in a pie in the sky sort of way, but how does this help tomorrow? And if you are willing to help and want to help, and I think the majority of people are, this is a partnership that can move forward and really make a difference long term, not just helping somebody out for a week and then they're right back where they started.
Health Connections was really able to help Luann and Pete reduce their fear and anxiety of the healthcare system. In a very chaotic and complex system, we were able to help break it down into pieces for them to make them feel more comfortable.
Luann is a very welcoming and friendly person, and even on those days where I knew she didn't feel well and she was struggling, even when she was in the hospital, she continued to show this outgoing personality that is just a part of her.
Since we've been working with Luann, I've seen her have some ups and downs with her health, but the most significant success that I've seen with her is her confidence in the ability to manage her own health at home. And that makes me extremely proud of the work that we do.
Health Connections have been wonderful for us, and I think probably for other people. But it gives you a sense of well-being to have them here, and someone that cares, really cares. It's great.